let me ask you about the period that followed those treatments, in particular how you were coping afterwards. And I know there was a complicating factor for you, wasn't there? And you mentioned it to me off the video, and I hope you don't mind me talking about it. It was the fact that you had a quite severe depression before the cancer was diagnosed.
Yes, yeah.
I think that was about a year before.
It was, yeah.
Do you mind talking about what happened in that year before, just in brief?
What happened was, I'd been not feeling very well. I've been on antidepressants for years because I've always suffered with anxiety and depression.
Yeah.
But it was pretty much under control, and I was under a psychiatrist, or have been for many years. Yes. For it. Because I wasn't feeling very well, and I'd been on my medication for a long time, the psychiatrist thought that maybe a change might be a good idea. But we tried to change the drugs, and it all went very, very, very pear-shaped.
Yes. So you didn't get on well with the new medication?
No,
suggested?
Not at all. And then I ended up in hospital for 4 weeks in the mental health unit at Glenfield, on the Heather ward at the Bradgate Centre.
Yes, I know the one you mean.
So I was there for 4 weeks, trying to sort of get the medication back on track. But unfortunately, it led to lots of things, this medication change. I even now don't leave the house alone. I always have somebody with me. Severe panic attacks, although they have bated quite a bit now. Severe anxiety attacks. It led to me having to give my job up, although I think that was part of too much pressure.
Was that the one in the payroll department?
Yeah, too much responsibility, and they were just putting more and more on me, and I couldn't cope with it anymore.
Yeah.
And I think it was a number of things that were happening in my personal life that sort of led me to feel poorly in the first place. And plus, I don't think the tablets were helping. But unfortunately, you know, it's left me in a bit of a horrible situation whereby I can't go out on my own. I don't drive my car anymore. I can't use public transport. So it's left me...
It's interfered with your independence.
Completely and utterly.
And that was the case before your cancer diagnosis?
Yes,
yeah.
It was.
And was your depression the kind that tended to come on out of the blue? Or could you identify a stress or a
No,
trigger?
it comes on out of it. It comes. It just hits me like a ton of bricks.
And was it a pure depression, just depressive symptoms, or other? You mentioned anxiety.
I had severe anxiety.
Yes.
Terrible. I was on, and still am, on lots of medication for it.
Yeah. Did you try non-medication approaches?
Yes. Well, no, that's a lie, because I can't actually get off what I'm on.
Yeah. But in addition, maybe to the medication, did you have talking therapy?
Yes. I started CBT.
Yes. Cognitive behavioural therapy.
Yes. And I was having counselling.
Overall, how effective were those treatment strategies for your depression?
I think I was so far in it, it was hard, you know. I think nothing was really working at the time. But a long time ago, I could never do relaxation. I found it really hard. But I practiced and practiced and practiced until I found that that was one of the things that actually worked for me eventually.
Relaxation.
And it took a lot.
What kind of techniques did you use there?
I use I have an iPod
Yeah.
that I download CDs onto the iPod.
Relaxation strategies.
Yes.
And is it the passive music type or the coaching type where they tell you what techniques to
Well,
try?
I've done both, and there's another one, isn't there, where imagery.
Visual imagery.
That is fabulous. You know, because it's lovely to imagine you going down to a nice beach with the water.
That works for you.
And it does for me. It doesn't work for everybody, and I know it's very hard to relax, and I could never do it for years, but I really, really made myself do it every day, 2 or 3 times a day, and that really did help eventually.
Now, how did that previous experience of depression complicate your recovery from the cancer?
Because obviously, you know, the being told that you've got cancer is a big blow to any person that are told that they have it. But the added complication is when you've already got depression and anxiety, it was twofold. It made it into a ginormous problem. And I found it very hard to cope. I couldn't sleep. But believe it or not, I didn't eat and I did lose weight. And the anxiety levels were absolutely horrific. Just the fear that I thought I might die, you know, this is it, I'm going to leave my children behind. What if it's already spread? You know, all these things go through your mind constantly. As time has gone on, you know, the anxiety levels have lowered. I was taking diazepam at the time to help me through. Not masses of it, but probably 2 milligrams a day or something, just to get me through the worst part of the day. But I find I'm not having to take that anymore.
Well, that's good.
And I've started to venture out a little bit.
So things are actually beginning to improve.
Things are starting to improve, yeah. And
even
plus,
compared to how you were before the cancer.
Yes, yeah. Plus, I've had great support from the psycho-oncology as well.
From the team, yes.
Yeah, I mean, the nurse that I have is fantastic, you know, and she supported me. Dr. Mitchell supported me, and, you know, I've had a nice big support network.